Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 8th lecture on systemic pathology. Today, day 2 of colorectal diseases. Day 2 of colorectal diseases. Today's topic is ulcerative colitis. Day 2 of colorectal disease. Today's topic, ulcerative colitis. Come to definition of ulcerative colitis. It is an idiopathic, recurrent, acute and chronic ulcero-inflammatory bowel disease, principally affecting the rectum and left colon. It is an idiopathic, recurrent, acute and chronic ulcero-inflammatory bowel disease, principally affecting the rectum and colon. Dear audience, it is an inflammatory bowel disease. It is an inflammatory bowel disease. The cause is not known, it is idiopathic. It is idiopathic. This disease is recurrent. It is recurrent disease. And in this disease, there is ulceration in the mucosal ulceration. And principally it affects the rectum and left colon. This is ulcerative colitis. Dear audience, now come to age of occurrence of ulcerative colitis. Age of occurrence of such type of inflammatory bowel disease. Age of occurrence usually at second decade of life. It usually occurs at second decade of life. Now come to sex. Ulcerative colitis occurs both in male and female, but it is more common in female. More common in female. Site of such type of inflammatory bowel disease, it may occur at any part of GI tract, may occur at any part of gastrointestinal tract, but common in rectum and in left colon. So like the Crohn's disease, it may occur at any part of GI tract, but it is more common in rectum and left colon. And Crohn's disease is more common in terminal ileum. Dear audience, now come to etiopathogenesis of ulcerative colitis. It is an idiopathic disease. The cause of such type of inflammatory bowel disease is not clear. cause is not clear, but it is suggested that genetic factor is associated with such type of inflammatory bowel disease. It is suggested that such type inflammatory bowel disease that is ulcerative colitis is associated with genetic factors. So it is thought genetic factor is associated with ulcerative colitis. Dear audience, now come to morphology of ulcerative colitis. Gross examination reveals it is a disease of continuity. It is a disease of continuity. It means there is no skip lesion like Crohn's disease. There is no skip lesion in ulcerative colitis. Rather, it is a continuous lesion in the GI tract. So it is a disease of continuity. It begins in rectum and extends in retrograde direction in left colon. It is a disease of continuity. This disease begins in rectum and it extends in retrograde direction in left colon. Dear audience, if this is the colon like this is transverse colon. If this is rectum, and if this is the beginning of ulcerative colitis, it begins here and in retrograde direction it extends to the left colon. So it is a disease of continuity. It begins in rectum and extends in retrograde direction in the left colon. Another morphology on gross examination. In acute phase of ulcerative colitis, crypt abscess in acute phase of ulcerative colitis. Dear audience, you know collection of pus in tissue or in hollow viscous lined by pyogenic membrane is known as abscess. In acute phase of ulcerative colitis, if this is the mucosa and if this is the crypt, within the crypt in acute phase there will be accumulation of pus. This is crypt abscess. Another morphology on gross examination, mucosal ulceration. Another morphology on gross examination, inflammatory pseudopolyps in the mucosa of the colon. Inflammatory pseudopolyp at the site of lesion, inflammatory pseudopolyp. Dear audience, we know tongue-like or finger-like projection from mucosa is known as polyp. As I have told you, ulcerative colitis is acute and chronic type of recurrent inflammatory disease of the bowel. Due to acute inflammation in the mucosa, there will be swelling. Due to exudation, there will be swelling. You know, in acute inflammation, there is formation of exudate, and due to exudate, there is swelling. At the site of lesion, there will be swelling like this, there is swelling like this, and this swelling is due to acute inflammation, and this is known as pseudopolyp. It is actually not polyp. This projection or this swelling is due to exudate in acute inflammation. So it is pseudopolyp and it is inflammatory pseudopolyp. It is one of the characteristic features of ulcerative colitis. So on gross examination, we get a continuous disease that begins in rectum and extends in retrograde direction in the left colon, crypt abscess in acute phase, mucosal ulceration, and inflammatory pseudopolyp. Now come to histopathology of ulcerative colitis. Histopathology reveals non-granulomatous inflammation in mucosa and in submucosa. Dear audience, histopathology reveals non-granulomatous inflammation. There is infiltration of acute inflammatory cells and chronic inflammatory cells, but there is no granuloma formation, where it is found in mucosa and submucosa. This is the histopathology of ulcerative colitis. Now come to, if anybody suffers from ulcerative colitis for a long time, what may be the consequence of ulcerative colitis? Dear audience, you know ulcerative colitis is one of the pre-malignant condition. So if anybody suffers from ulcerative colitis for a long time, there is chance of malignancy. Ulcerative colitis is a pre-malignant condition. And this pre-malignant condition may turn to malignancy. It may turn to malignancy. So this is the consequence of ulcerative colitis, and this is all about ulcerative colitis. It is an inflammatory bowel disease. It is idiopathic inflammatory bowel disease. There is mucosal ulceration. It is recurrent. It is acute and chronic. Age of occurrence is usually second decade of life. Female affected more than male. It is thought that genetic factors are associated with ulcerative colitis. Gross examination reveals a continuous disease, continuous lesion in the GI tract. Most commonly it occurs in the rectum, and it begins in rectum and it extends in retrograde direction in the left colon. On gross examination, there is mucosal ulceration. In acute phase, there is crypt abscess, inflammatory pseudopolyp. Histopathology reveals non-granulomatous inflammation in mucosa and submucosa, and it is a pre-malignant condition and it may turn to malignancy. Dear audience, you know Crohn's disease is inflammatory bowel disease. Ulcerative colitis is also inflammatory bowel disease. You know Crohn's disease may occur at any part of the GI tract. Ulcerative colitis may also occur at any part of GI tract. Now come to how can we differentiate Crohn's disease from ulcerative colitis. Now come to what are the differences between Crohn's disease and ulcerative colitis. Differences between Crohn's disease and ulcerative colitis. Site of Crohn's disease, it may occur at any part of GI tract, but commonly it occurs in terminal ileum. Common in terminal ileum. It commonly occurs in terminal ileum. Ulcerative colitis may occur at any part of GI tract, but it commonly occurs in rectum and left colon. Common in rectum and left colon. Lead pipe appearance, that is, or rubber hose appearance. The lesional part of Crohn's disease looks like rubber hose or looks like lead pipe. So lead pipe appearance is present in Crohn's disease. It is absent in ulcerative colitis. Dear audience, you know Crohn's disease is ulceroconstrictive disease. It is a chronic disease. There is fibrosis. Due to fibrosis, due to chronicity, the lesional part become narrow and the wall become very thick, and it looks like lead pipe appearance or rubber hose appearance. Skip lesion. Dear audience, you know in Crohn's disease, lesional part is followed by non-lesional part. So skip lesion is found in Crohn's disease, but it is absent in ulcerative colitis. The ulcerative colitis is a disease of continuity. Present in Crohn's disease. Suppose this is the non-lesional part of Crohn's disease and this is the lesional part of Crohn's disease. Again, this is non-lesional part of Crohn's disease and followed by lesional part of Crohn's disease. So non-lesional part, lesional part, non-lesional part, lesional part. This is skip disease, and it looks like rubber hose or looks like lead pipe appearance. Skip lesion absent in ulcerative colitis because it is disease of continuity. Crypt abscess is absent in Crohn's disease present in ulcerative colitis. Pseudopolyp, inflammatory pseudopolyp is absent in Crohn's disease but present in ulcerative colitis. String sign, string sign is present in Crohn's disease, absent in ulcerative colitis. Dear audience, you know, in case of Crohn's disease, if barium swallow through is done, thin rim of white barium is seen in the lesional part due to narrowing of the lumen at the lesional part of Crohn's disease. If we think this is the narrow part of the Crohn's disease and there is narrow lumen, if this is the barium, all the barium is white, the barium looks like a string, but in the non-lesional part, the full lumen is filled with barium. This non-lesional part, the lumen is fully filled with the barium, but in the lesional part, the barium looks like a thin stream of barium and it looks like a string, and this is called string sign. This is string sign. The string sign is absent in ulcerative colitis. Other differences: histopathology, histopathology of Crohn's disease reveals transmural inflammation by non-caseating granulomatous inflammation. Transmural inflammation by non-caseating granulomatous inflammation. Dear audience, histopathology of Crohn's disease reveals there is non-caseating granulomatous inflammation. There is granulomas in mucosa, submucosa, muscle coat and serous coat, that is transmural. The mucosa, submucosa, muscle coat and serous coat, all the 4 layers of the intestine is infiltrated by non-caseating granulomatous inflammation. But histopathology of ulcerative colitis reveals only mucosa and submucosa is infiltrated. It is infiltrated by non-granulomatous inflammation. So in case of Crohn's disease, we get granuloma, but in case of ulcerative colitis, there is no granuloma. Only mucosa and submucosa is infiltrated with non-granulomatous inflammation. Another difference: signs of malignancy. Less signs of malignancy in Crohn's disease. Less signs of malignancy in Crohn's disease, but more signs of malignancy in case of ulcerative colitis. So these are the differences between Crohn's disease and ulcerative colitis. Dear audience, today I have told you about the ulcerative colitis. It is an inflammatory bowel disease, the cause is not known, there is mucosal ulceration. It may occur at any part of GI tract, but it commonly occurs in rectum and left colon. There are some differences between ulcerative colitis and Crohn's disease. I have told you briefly in tabulated form. Dear audience, today up to this, thanks all.